Hey everyone, my name's Devin Crevani. I'm a physical therapist at Robbins Rehabilitation East, and as part of our Top 3 Things series, I'll be going over today top 3 things to know about dizziness and balance as it pertains to physical therapy being an option for assessment and treatment of those issues. So we'll get started by saying that dizziness and complaints of unsteadiness or imbalance are one of the main reasons why people end up in medical care, especially in the emergency room. And there are also some types of dizziness can be very unsettling for people, especially if they have an abrupt onset. And so what we'll do today is we're going to discuss the systems of your body, one of the systems of our body that can be contributing to dizziness, how that happens, and then how a physical therapist can potentially help you to understand and treat your problem. So the way I guess I'll get started is that we have 3 systems of balance that generally keep us upright, functioning as human beings, walking around, that sort of thing. And the one we're going to focus on is called the vestibular system. So oftentimes when we have complaints of dizziness, the room spinning, or imbalance, we can kind of localize that to something going wrong with the vestibular system or not functioning correctly. Now, before I get too far into what the vestibular system is, we'll kind of take a step back, and the first point that we'll talk about is, what is the difference? Is there a difference, and what is the difference in terms of dizziness, vertigo, some terms you may have heard. So the point that I want to make for the first point for this video is that the terms themselves kind of get thrown around, like say I'm dizzy, or I'm unsteady, or I have vertigo, and there's traditional definitions for what those mean in the medical community, and then there's definitions for what people generally, laymen, refer to. And so there can be some confusion there. So we'll kind of set the ground rules of this discussion by saying, dizziness is just any sort of feeling of unsteadiness or feeling of disequilibrium. So feeling like you're not steady and you don't feel secure in your footing. Different things can cause that. And on the flip side, vertigo would be the idea that the room is spinning. So you feel unsteady, you feel like the room is spinning. There's more types of unsteadiness that fall outside of those 2 classifications, but we'll just take the time, because it's a lengthy discussion, to kind of subdivide those 2 categories. So now we'll get into what the vestibular system is and how it contributes to either dizziness or vertigo. So the vestibular system is kind of the connection of wires, if you consider our nerves as wiring, that allows us to detect head movement in space and generally controls postural reflexes that keeps us upright. Okay, so a lot of our body movements are controlled by reflexes, especially when it comes to balance. And those reflexes, when it comes to the vestibular system, basically function when your body detects, this vestibular system detects head movement and subsequently then contracts muscles close to your midline, so kind of close to the core of your body, to keep you from your center of mass kind of within your support, your base of support. So the further away you kind of reach or are moving outside of your base of support, the further away your balance is challenged, your body's ability to stand up against gravity is challenged. So the vestibular system detects that. Now, how does it do that? So there's an organ in your inner ear called the vestibular organ. There's other words and names for it, but basically it's a series of canals that through some complicated mechanics, which I won't discuss today, detect head movement. That head movement is transmitted into electrical signals that are passed through your vestibular nerve into your brain. Your brain processes all that information, and lo and behold, the vestibular system information helps keep you upright. So taking a step further, one of the most common, and this will be the third point, one of the most common causes of vertigo, which basically is the sensation of the room spinning, which can be very unsettling if someone hasn't ever experienced that before, can sometimes be accompanied by nausea, is a benign condition. So by benign, I mean it's a normal, and it's usually a non-progressive condition called BPPV. And that's, to be clear, the letter B, the letter P, the letter P, and then the letter V. Kind of a mouthful to say, and basically that is a condition that can be very easily assessed in the office with a bedside exam, a bedside screening test that a physical therapist can do, and it's often underdiagnosed. And the good thing is that if you have BPPV, chances are it can go away on its own. Research has shown that, but it can take some time. So evaluation by a skilled physical therapist, skilled medical practitioner can determine if your dizziness or vertigo falls under this category, and through testing can basically help you either with treatment in the office or referral to someone else who can better help you. So that kind of summarizes our top 3 things for dizziness and balance. If you have any further questions on that front, you know where to find us. So hope that video was helpful. It's a pretty complex topic, so reach out, and I hope you enjoyed the video.